Well, some of Oregon's members of Congress got together today to sound alarm bells for Planned Parenthood, which took a major hit under President Trump's spending bill, the so-called Big Beautiful Bill. The bill includes a provision that blocks all Medicaid funding for 1 year to certain clinics. Now, Planned Parenthood said today that even though they weren't named in the bill, they're the only clinic the law targets.
So it was written in a way that you must be a nonprofit healthcare provider, check, provide reproductive health care, check, abortion care, check, and receive more than $800,000 in Medicaid revenue annually. And it turns out that the only organization in the entire country who meets all four of those criteria is Planned Parenthood. So this is specifically only Planned Parenthood. Our colleagues, our very respected, esteemed colleagues who also provide abortion care in Portland and in the state of Oregon are not targeted and are not losing funding. This is only Planned Parenthood.
Oregon has 2 Planned Parenthood affiliates with 13 clinics across the state. They served about 74,000 people last year. They say around 60% of them were on the Oregon Health Plan, which is the state's version of Medicaid. They say for many of their patients, Planned Parenthood is the only health care provider that they have. And they do a lot more than provide abortions, a point that Oregon Senator Ron Wyden made sure to get across today.
Planned Parenthood does so much, folks, that has nothing to do with abortion. Let me repeat that again in case we're possibly missing it. They're doing an enormous amount of good work that has zero to do with abortion. They're doing cancer screening, they're doing mental health care, prenatal care, postpartum care, treatment of sexually transmitted diseases. The list goes on and on.
Planned Parenthood does perform about 10,000 abortions a year, and they say they're proud supporters of abortion care, but they say it's only accounting for about 10% of what they do. But now they say all of the work they do is threatened.
While so many people come to Planned Parenthood for things like STI testing and birth control, we also know that this attack on Planned Parenthood is a direct attack at abortion access in the states where it's still legal, like here in Oregon. When Planned Parenthood clinics cannot afford to care for patients, clinics will close and all care becomes more difficult to access. Providers become overwhelmed and patients are left without care.
In addition to closing clinics, Planned Parenthood says if they continue to not receive Medicaid funding or some other source of funding, they're going to have to start reducing service. But they say right now, Medicaid patients should still come in and get their health care.
The 2 Planned Parenthood affiliates have really committed to continuing to see Medicaid patients. So every day we are seeing thousands of patients and we are not billing for those services. So from the patient perspective, our doors are open. We want you to come and see us. And this is not something that we can sustain.
Well, Planned Parenthood got a 2-week break after the bill was signed by President Trump on the 4th of July. A judge ordered a temporary injunction, but it's since expired. Washington Governor Bob Ferguson earlier this month committed to backfilling the money Planned Parenthood is losing there with $11 million in state money. Earlier this year, the Oregon legislature earmarked $10 million for Planned Parenthood, but the group said today that will not be enough.
So we have been for years operating with Medicaid rates that only cover 50% of the cost of care. So that money was really to help stabilize in the existing system where we were receiving low Medicaid rates. We are now receiving $0 for those rates. So while that money is very helpful and has allowed us in the short-term period to continue to see patients uninterrupted, that money will only last a couple of months. And so we are already burning through that money, and we will be forced to make some really hard decisions if the state doesn't stand up in a bigger way.
You recognize Representative Andrea Salinas here. She said that Congress has ideas on the table, but they'll need Republican support, so that's not super likely. She's also urging the state to help out.